welcome into Your Health. And actually, March
This is February.
is going to be coming right after February.
Absolutely.
And we're laughing about if you mess up. Okay, there's a cutie.
No.
There we go. We're talking about February.
Absolutely.
So now our guest is comfortable. She can mess up if I can.
Amen.
We are lucky today. We have Sylvia Dunn with us today. And February is Heart Month.
Yes,
and we are going to be talking about your heart. And Sylvia, you have an interesting story, so we need to pay attention to this.
Yes, we do. Heart disease is a very serious problem, and women especially don't realize that. A lot of people think it's just a men's disease, but it's not. It affects women as well, and actually heart disease affects more women than all cancers combined.
Wow.
I know there's a big awareness of breast cancer, but actually heart disease is very important as well. And it's underdiagnosed in women, and I think it's very important for women to be aware of that. My case, for example, I started having classic chest pain, like they explain, you know, you think in the movies, you know, I'm having a heart attack. Yeah, and you grab your chest. Well, I had those kind of symptoms, but a lot of times women don't. A lot of times women will have jaw pain, arm pain, just non-specific things. So it's important if something like that is happening that they be aware that it could be their heart and they need to get it checked out.
Are there any other symptoms with women, or like shortness of breath?
Shortness of breath, fatigue, just generalized tiredness, you know, all those things that, you know, if not explained by something else, you know, could be your heart, you know, to have those checked. You know, if you have shortness of breath walking, you know, without, you know, something new,
Right.
you know, just be sure and have that checked out.
You actually are in charge of the rehab, the
Cardiac rehab at Baptist South. We work with heart patients after they've had an event, and I actually went through our cardiac rehab program after I had my heart. I had bypass surgery as a result of my chest pain. I had went in for a stress test, had a heart cath the next day, and had bypass surgery, or a lot of people call it open heart surgery, the next day.
Wow.
Yeah.
Yep.
And I was young.
Been down that road.
Yeah.
Yeah, Jack has.
One day, second day, and third day you're in.
Right,
Yeah.
exactly. If it's serious, they move pretty quick.
Yes, they do.
Because time is tissue, is what we say. Want to save that heart tissue.
You know, we talk about the fact of heart disease. And when our viewers think of the word disease, it's kind of, oh, you've got this disease, like cancer is a disease.
Right.
Is this a curable disease, or is it a disease that once you've got it for the rest of your life, and you just have to keep it in control?
Right. It's a disease that can be managed.
Okay.
I will always have heart disease.
So will I. Yeah.
Right. But it is controllable and manageable. There's medications, there's things that we can do and do to maintain a healthy lifestyle.
That's amazing.
So as we age, I know you were very young, so it doesn't matter, but I would think it would be more likely the older we get.
Right. There are some conditions that are more prevalent the older we get. High blood pressure, high cholesterol, atherosclerosis, which is a very difficult word to say, with hardening of the arteries.
Right.
And those conditions lead to a more likelihood of having heart disease. And diabetes. Diabetes is a huge contributor
Absolutely.
to heart disease, and it gets more prevalent with age.
Well, thank you so much. We're starting out
Right.
today, and we're going to acquaint you with this, and then next week we'll have Sylvia back, and we will talk about some more information that you need to keep your heart healthy.
Right.
And thanks so much for being with us, and we'll be right back.